Thank you, Dr. Ramsingh, for starting an important conversation and most of all for keeping the conversation going. Keisha, we must say congratulations on your achievement, and we hope that university is good for you. Leela, is she here, or can you take the message across for us? Thank you. We step into another virtual presentation, and this time from Dr. Kamilla Kamaruddin. Dr. Kamaruddin is a general practitioner in transgender healthcare and clinical lead East of England Gender Service.
Good morning to all distinguished guests. Unfortunately, due to working commitments, I'm not able to join all of you at this conference. But thank you for the opportunity to speak today on a matter of great importance for all of us, not just to those in healthcare, but to all of us as individuals, communities, as business leaders. I want to talk about a crucial issue that impacts our society and our future, the need to improve healthcare access for marginalized communities. My name is Dr. Kamilla Kamaruddin. I am a GP and also clinical lead at East of England Gender Service in Cambridge. I have been a doctor for almost 30 years. So let me begin with some sobering statistics. It is well documented that marginalized communities, whether defined by race, socioeconomic status, gender identity, or other factors, face disproportionately higher rates of chronic diseases such as diabetes, heart diseases, and cancer. But it just doesn't stop there. Mental health disorders, which are increasingly recognized as equally important to physical health, are also prevalent in these groups. These individuals often face barriers to accessing care, whether it's due to financial constraints, lack of available healthcare facilities, or a history of discrimination within the healthcare system. As a result, these communities experience higher morbidity and mortality rates. They live shorter, they have less healthy lives, and often encounter the healthcare system at its most urgent, when health has already significantly deteriorated. Imagine for a moment human cost of these health disparities, families torn apart, communities weakened, and lives cut short. But the consequences are not just only personal. They extend far beyond the individuals affected. Poor health in marginalized communities leads to greater healthcare costs, a less productive workforce, and a more fragile economy. This is where business organizations can come into play. The need for improving healthcare for marginalized communities is not simply a moral one. And also the need to address healthcare disparities is also not simply a moral case. It is also a strategic business decision. Companies that invest in health and well-being of marginalized communities are laying the foundation for a more productive, resilient, and sustainable workforce. Healthcare employees are more engaged, miss fewer work days of work, and contribute more effectively to the success of their companies. Additionally, businesses that engage with underserved populations can foster loyalty, expand the customer base, and improve brand reputation. The moral and business cases for supporting healthcare access are not mutually exclusive. In fact, they are complementary. So I would like to share some examples of how businesses have made a tangible impact on healthcare access. So there's a lot of pharmaceutical and healthcare innovations. Companies in the healthcare sector have developed programs aimed at improving access to care for marginalized communities. One such example is partnerships between businesses that are and community healthcare clinics, where corporations sponsor healthcare initiatives to address both physical and mental health challenges. These partnerships reduce the cost burden on underfunded healthcare systems and provide critical care for those who otherwise would have gone without. There's also technology in telemedicine. which have pioneered the use of telemedicine to bridge the access gap. So there has been particularly impactful during the COVID-19 pandemic, where travel restrictions and social distancing made in-person healthcare visits difficult or impossible. So by supporting telemedicine infrastructure, business can help ensure that healthcare is accessible to marginalized communities, even in the most remote areas. And there's also workplace health programs. Some companies have taken the initiative to support their employees by offering health programs specifically tailored to the needs of marginalized communities. This could include free access to mental health resources, wellness programs, and even financial support for medical treatments. These companies are not only improving the health of their employees, but also benefiting from improved productivity and morale. So how can business organizations help? Business can develop strategic partnerships. The answer is multifaceted. So one of them is that we can develop strategic partnerships. Businesses can work alongside healthcare providers, NGOs, and government agencies to implement health initiatives in underserved areas. These partnerships can take many forms, from direct funding for health programs to logistical support for mobile healthcare units. And corporate influence is very, very powerful. Companies can use their platforms to advocate for policies that promote healthcare equity, such as expanded healthcare coverage, funding for community health centers, and investment in preventive care. So by aligning business interests with social good, companies can play a significant role in shaping public health policy. Investing in employee health and well-being is also crucial. Businesses should extend the focus on employee health beyond the office walls, offering comprehensive healthcare coverage, including mental health support and preventive care, can help address some of the systemic disparities that these employees may face. So more importantly, ensuring that employees from marginalized communities feel supported and heard is a critical step forward achieving health equity in the workplace. And business can support health education and preventive care. Many communities suffer from lack of health education. Businesses can sponsor health awareness campaigns, particularly for chronic diseases, mental health, and preventive care. So providing resources and creating platforms for education helps individuals make informed choices about their health. And lastly, perhaps the crucial inclusion to promote diversity in healthcare leadership. A more diverse healthcare workforce will be better equipped to meet the needs of all populations. Businesses can play an instrumental role in promoting diversity within healthcare organizations, from sponsoring scholarships for underrepresented groups to supporting mentorship and leadership development programs. So what does it matter? What does it matter to all of us? So I know many of you are wondering why this is relevant for your businesses. So let me be clear, how improving healthcare for marginalized communities isn't just about fulfilling corporate social responsibility. It's also about ensuring that society thrives in a way that benefits all of us. As we move forward to a more inclusive and equitable world, the well-being marginalized communities will ultimately benefit everyone, from individuals to businesses and to the entire nations. Businesses that engage in these efforts build stronger communities, reduce healthcare disparities, and contribute to a more productive and engaged workforce. These businesses don't just respond to societal needs, they actively shape the future. I remember 30 years ago when I started working as a doctor. I was a very junior doctor in Kuala Lumpur. At the height of the AIDS epidemic, there was a rule that we should not be being admitted to the hospitals, because the thinking at that time was that it is no point because these patients would die anyway. And I remember this very young man who was admitted for an infection in his groin from injecting his groin with drugs. So he was a drug abuser. And he was admitted for infection. And So he was not given any antibiotics or any other treatment, and the care was just some basic nursing care. And before I left the room, he looked at me and he said, "Oh, doctor, please help me." And I had to look away, perhaps in shame, because I could not offer anything. Yes, unfortunately, he died a few days later. And I could still, 30 years later, I could still remember his face and the look of despair on his face, and was pleading to me, "Please help me, doctor." And 30 years later, when I found myself on the other end of the marginalized communities, when I've been part of the marginalized communities due to my race, my skin color, my gender identity, I am relatively part of the marginalized community. And although not in the same, in the throes of death, but I understood what he meant when he said, "Please help me, doctor." What he meant was that, "Please treat me with dignity and respect." So I refuse to remain silent in complicity. And improving healthcare access for marginalized communities isn't a task for healthcare professionals alone. It's an issue that requires the collective effort of businesses, governments, and civil society. By prioritizing healthcare equity, businesses can not only fulfill their corporate social responsibility, but also create a thriving environment where all individuals have the opportunity to live healthy, fulfilling lives, where all individuals can be treated with respect and dignity. So when we talk about improving healthcare access for marginalized communities, when we talk about inclusivity, don't blame poor people, but blame poverty. Don't blame women who are victims of domestic violence or sexual assault, but blame misogyny and the perpetrators and toxic masculinity. Don't blame gay people, but blame homophobia. Don't blame trans people, but blame transphobia. So let's work together and let's try and improve healthcare for marginalized communities. I know it's not fashionable to talk about marginalized communities at this present environment, political climate, but we have to continue trying, and we have to continue improving healthcare for marginalized communities, because that's basic essence of humanity. Thank you very much for listening.